Hi, this is Dr. Amy Harwick, and today we're going to talk about attachment theory and attachment in relationships. If you've ever felt like you were in a relationship where you or your partner was more detached or emotionally shut down, fearing commitment and intimacy, or on the other hand, you or your partner felt so anxious that you call the person 10 times after you're in an argument, or you feel like they're always going to break up with you or reject you, both of those extremes may be because of attachment issues, and attachment stuff happens with everybody. So it's really important to understand what it is, why it happens, what your attachment style is, so that you can work through that and work with your current relationship. So what is attachment theory? Attachment theory is a physiological model that looks at short-term and long-term relationships and looks at how people act and respond when there's a perceived threat or when they feel like their partner's going to be separated from them or when they're hurt. So attachment theory was coined by John Bowlby, and what he did is he really looked at primates, little baby primates, and how they reacted and responded with their primary and familiar caregiver. So when they had a secure attachment or they knew that caregiver was going to be around, these little baby monkeys they felt free to explore. And we can also attach that to human babies. So when human babies have that secure base or they know that primary caregiver is going to be there, they're more relaxed and free to explore their environment, and that exploration leads to growth. So the next thing I want to talk about is the strange situation test. So shortly after John Bowlby was looking at attachment theory, they did this strange situation test where they took babies that were 9 months old to 18 months old, they put them in a room with their mothers, and they wanted to look at when the mothers left, how did these babies react and respond, and how were they when the mothers came back into the room. So the first group was the anxious babies. So these anxious babies, when the mother left the room, they were visibly very upset. They were distraught. They were crying. They were loud. Mother came back into the room, and they didn't calm down right away. It took them a while to calm down, and they still showed intermittent signs of anger towards the mother figure, and it took them a while to get back down to normal. Whereas a secure baby, mother left the room, they would cry. Mother would come back into the room, and pretty quickly they were relaxed. They knew mother was there, and they could go about playing with their toys or doing whatever they were doing. But what's the most interesting to me is that the babies that classified as avoidant, when mom left the room, they acted like they didn't really care. No change in their behavior. Mom came back into the room, again, acted like they just didn't really care. They were unfazed by this. But what happens is when they looked at these babies' heart rates and their cortisol or stress hormone level, is that they were equally as elevated as the anxious babies. So even though these babies looked like they didn't care at all, they actually were highly distressed. But they didn't look like it, and they weren't connected to their levels of distress, but their bodies were distressed. So we can look at that and apply that to adults with these same anxious and avoidant classifications, is that the anxious babies knew they were very upset, they were visibly freaking out. But the avoidant babies, it looked like they didn't care, but actually they did. These attachment styles will affect so much in your life, but especially your relationship. So based on your attachment style, that really changes how you view many different things. And that could be how you view intimacy, how you view sexuality and engage in sexual practices, how you communicate, how you have conflict, and overall what your expectations are in a relationship. So in the 1980s, they started applying attachment theory to adults and relationships. And this is what they pretty much figured out with that. So secure is about 50% of the population. 25% of the population classifies as anxious attachment. About 30% of the population is avoidant attachment, and a small little bit of 3 to 5% of the population is a combination of both anxious and avoidant attachment styles. So let's break down these attachment styles. There's secure, anxious, and avoidant. Even though these are classifications, remember these are socially created classifications we use to help understand people a little bit better. And even if you are in one of these categories pretty strongly, people can change. Not overnight, not drastically, but people can change. Plasticity is probable and possible. Also, even with these classifications and categories, of course there are things that are more challenging, but each has their own strength as well. So secure people are secure. They are dependable, they communicate well, they have a flexible view of what a relationship can be, they can compromise in an argument, they're upfront, they're not scared of closeness, and they will do things to actually bring you closer with them. So ultimately, for everybody, having a secure partner is the ideal. However, that's not everybody. That's about half the population. So people with anxious attachment really struggle with some things, and those things might be fearing that the relationship will reject them at any point in time, being suspicious that their partner might be unfaithful. That person could act out a little bit more, be manipulative to get their partner's attention, especially if they feel like there's going to be a rejection or something that could be threatening to the relationship at all. They might be overly enmeshed or overly involved in the relationship. These are also people that might feel like they always have to be in a relationship. So lastly, the avoidant person or somebody with avoidant attachment might do whatever they can to distance themselves from the relationship, and that includes using distractions. Something little like a hobby or something more extreme like an addiction are pretty common ways to distract yourself from intimacy in a relationship. This person's going to repress their emotions rather than express the emotion. In fact, even talking about the dynamic of the relationship might be difficult because that would increase intimacy. So it might be hard, or they might fumble over talking about the what's going on between us kind of conversation. This person might need to get away when you're having an argument, otherwise they're going to explode. Dealing with actual intimacy is very difficult for a person who has avoidant attachment. So it's something to consider if that's your partner or yourself.